There is a lot of misinformation about knee pain circulating online today. Much of what we were taught 10 years ago is now scientifically outdated. Today, let's look at the four biggest myths about osteoarthritis and what the 2025 evidence actually tells us. Myth number one, it's just wear and tear. The most common myth is that your knee is like a mechanical hinge that has simply worn out. Tenji poche, घिस गया. The reality, arthritis is not passive wear. It is an active biological failure. It's an inflammatory and metabolic disease of the entire joint, including the bone and the lining. Your knee isn't wearing down. It's struggling to repair itself against a tide of molecular inflammation. Myth number two, weight is the only cause. We are told that weight crushes the joint, leading to arthritis. We are counseled to lose weight. The reality, while mechanical load matters, the metabolic impact is often more destructive. Fat tissue is biologically active. It releases adipokines that travel through your blood and actively dissolve cartilage. This is why people with metabolic issues often get arthritis in their hand joints, joints that carry no weight at all. Myth number three, muscle weakness is the root problem. Many claim that if you just condition your muscles, the arthritis will vanish. The reality, while strong muscles are vital for stability, they cannot fix a joint. If the internal environment of the joint is toxic with inflammatory cytokines like IL-1, no amount of exercise can stop the biological degradation. We must treat the chemistry of the joint, not just its mechanics. Myth number four, joint replacement is the only final option. Patients are often told to wait until it's bone on bone and then get a total knee replacement. The reality, surgery should be the last resort, not the only resort. With the Prasad protocol, we use your body's own stromal cells and growth factors to act as a biological pharmacy. We aim to reset the joint's internal environment, neutralizing inflammation and promoting joint rejuvenation rather than just replacing the part. In conclusion, a new paradigm. Don't let outdated myths dictate your mobility. The future of orthopedics isn't just about metal and plastic, it's about biology and repair. Thanks for watching. If you found this video inspiring, insightful, and valuable, don't fail to share it with some near and dear ones. Like this video, give it a thumbs up, subscribe to my channel Madras Joint Rejuvenation Center, and press the bell icon to receive notifications whenever I upload videos like this in future. I'll see you in another video. Cheers.